Hi, I'm Dr. Hachi, a veterinarian in Japan. If your dog were feeling unwell, are you confident you'd notice right away? Today's topic, 4 health checks every dog owner should do. Dogs can't speak, so noticing the signs yourself is one of the most important things you can do to protect their health. Miss those signs, and by the time you realize, it can already be too late. Today, from a vet's perspective, I'll share 4 things you should absolutely keep an eye on. The last one is so easy to check, yet missing it can directly cost your dog's life. If you want your dog to stay healthy by your side, please watch until the end. Health check number 1. Measure how much water your dog drinks. Do you know how much water your dog drinks in a day? Drinking too little is worrying, but drinking too much is actually a problem too. A healthy dog drinks roughly 50 milliliters per kilogram of body weight a day. If your dog is drinking over 100 milliliters per kilo, something is likely wrong in the body. Diseases that increase thirst include diabetes, kidney disease, and hormonal disorders. These diseases drain water from the body. The dog drinks more to win that water back, so restricting water because he's drinking too much is dangerous. Please don't do that. You don't need to measure every day, once or twice a month is enough. Here's an easy way. Fill a 500 milliliter bottle with water and top up the bowl only from that bottle at the end of the day. Check how much is gone. That's your dog's daily intake. Quite a few diseases show up first as increased thirst. It's a great early detection sign, so please give it a try. Health check number 2. Check the gums. Gums are something we vets always examine during a physical. You probably don't look at them much, right? But the gums are a key sign of blood pressure and anemia. 2 things to look at, the color and the moisture. First, the color. Healthy gums are pink. If they look pale or white, it can mean anemia or low blood pressure. A limp, listless dog with white gums is often an emergency. Yellowish gums can hide liver or gallbladder trouble, a state called jaundice. It often means something serious, so see a vet if you spot it. Next, the moisture. Healthy gums feel slightly sticky, leaving a little saliva on your finger. If they're completely dry and nothing comes off, your dog may be dehydrated. This often happens after diarrhea or vomiting, so when their stomach is off, check how moist the gums are. You can see the gums just by lifting the side of the lip. That tiny habit can completely change how early you catch a disease. It doesn't have to be daily. On days your dog seems a bit flat, take a look at their gums. That's what the gums can tell you, but signs don't only appear inside the mouth. Something you see every single day holds an important clue. Let's look at that next. Health check number 3. The color of the urine. Urine color flags trouble at an early stage. In my exam room, it's not rare for an owner to come in saying, "The pee looks strange," and we find a disease. Because dogs pee every day, it's one of the easiest things to check. 2 colors to worry about, red and unusually pale. First, red urine. Red usually means blood is mixed in. That's called hematuria. The common causes are bladder infections and urinary stones. But in older dogs, a tumor of the bladder or prostate can be hiding behind it. Even if your dog seems fine, bloody urine is never normal. Don't wait and see. Get to a vet early. Next, pale urine. If it's nearly clear, like water, day after day, the body may be failing to concentrate the urine. Kidney disease, diabetes, and hormonal disorders can all make urine pale. If the color looks thin, check whether it's just one day or continues for several. If it goes on for days, it's worth getting tested. Urine color takes almost no effort to check. Something looks different today. That little hunch is what leads to catching disease early. And the last health check, count the breathing rate during sleep. Breathing during sleep is a key window into the heart and lungs. A dog can look perfectly fine while the breathing is already changing. Heart and lung disease can turn life-threatening as it progresses, so counting sleep breaths really matters. The method is simple. While your dog is fast asleep, count how many times the chest rises in 1 minute. For small dogs, the guide is under 30 breaths per minute. If it stays above 30, the heart or lungs may be under strain. If it stays above 40, see a vet as soon as you can. One key point: measure when the breathing is at its calmest. Dogs dream too, so breathing speeds up and slows down even in sleep. If the count comes out high, wait a while and count again. Diseases behind fast breathing include pulmonary edema and pneumonia. First, pulmonary edema. Fluid building up in the lungs. It often happens when heart disease progresses. A dog that seemed fine can suddenly start breathing hard. The sleeping breath count is said to rise days before the edema hits. Catch it early, and your vet has a much better chance of helping your dog. That's exactly why the regular count matters. Next, pneumonia, lung inflammation caused by bacteria and other infections. There may be fever or coughing, but fast breathing is sometimes the very first sign. Dogs often look fine while the breathing has already changed. Counting sleep breaths may feel like a chore, but it's a precious signal of how hard breathing has become. It doesn't need to be daily for healthy dogs. Once a week is plenty. If your dog has heart disease, check more often as your vet advises, and for senior dogs, please make it a habit. So, that's all for today. Noticing small changes early is what protects your dog's health. This channel is all about helping your dog live a longer, healthier life. Subscribe so you don't miss the next one. Thanks so much for watching.